Hi, good evening, everyone. My name is Shiva, and I'm delighted to be the host for this session. Uh, I have been fortunate from a host point of view because this is the third session I'm hosting, and all the subjects in the session are topics that would be of interest to a coach from a career point of view. Because yesterday I was in a session called the employability and coaching, which means that a coach would have found a new career in coaching potential employees. This morning I was in a session moderating a session on sports coaching, which means that a coach would have found a new career in looking at sports people as potential clients. And here I am talking about the role of coaching in the medical field, and I'm hoping that by the end of this 1 hour, all of us as coaches will say, wow, this is one huge field that we have not even thought about as far as coaching is concerned, right? And that is what this session is about: coaching for patients, coaching for caregivers, coaching for staff, coaching for nurses. And you cannot ask for better people. You can't ask for better people to talk about this than the three panelists here. Two of them speakers, one of them a moderator. So I want to start by introducing Dr. Pritika Chari. Now, Dr. Pritika Chari, you're going to be there's so much to say that I don't know what to say. But let me say the most important things according to something that wowed me. Okay, um, Dr. Pritika Chari is both a neurosurgeon and a neurophysician. Can you ask for more? Normally in a hospital, you go to a neurosurgeon, she will say you go to the physician. You go to the physician, she'll say you go to the surgeon. Here you are, one person, two doctors, and your job is over. Brilliant, right? Now she doesn't stop with that, but she doesn't stop. Okay, she goes on to working for several social service organizations. She's part of the Rotary Club. She's part of the Madras Management Association, and she's also part of the Duchess Club. Actually, after she said Duchess Club, I looked at the Duchess Club. No, unfortunately, I am not eligible to join the Duchess Club, right? And 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 the more important thing, something very very powerful. Can you believe, especially for the coaching people in this audience, she is a qualified NLP master practitioner. She is a certified soft skills trainer, and she's a life and brain health coach. Wait, not over. She's also an image consultant. Can you believe it? So any one of you who thinks that you don't look good enough, you have a neurosurgeon, a neurophysician to go to look at your image. Therefore, I think kudos to the conclave for having identified Dr. Pritika Chari as a speaker today. And now, of course, the honors don't stop, right? So then, of course, there is Rosari, who's smiling there. Rosari, yeah. So Rosari is when Vijay sent me when Vijay sent me Rosari's profile, something struck me that there's so much of lateral thinking that she was doing. I'll ask her the questions later on. But let me tell you about Rosari. Rosari is the National HR Director in Ireland's largest employer, the Health Service Executive. And we just heard that there are about 130,000 people in that organization. 130,000 people. She's a passionate believer in maximizing organizational performance, staff engagement, and promoting the benefits of coaching in the workforce. You can't ask for a better person. She was also awarded, look at the awards now, okay? She was awarded the ICF Ireland Business Executive Coach of the Year. So for all of us, there's much to learn from her. And the Legal Ireland HR Leader of the Year. So HR and coaching. And she's also, if you can see under Rosari, right? You can see she's the Global Board Director of the International Coaching Federation. And I am personally indebted to this conclave because I have the opportunity to introduce the two of them. But then not over. We have one more person, the moderator, right? Venkatadri as he is called, but Venkat as he is known, right? Venkat, the first time I met Venkat, it was in Cindy. I'm doing this MCC program. It was in Cindy's class, and Cindy said, "Shiva, you're going to meet one MCC." So we are all a little nervous. And then Venkat comes and speaks. For all of you here, Venkat is actually a direct MCC. Direct MCC. He didn't go through the PCC and the ACC that all of us did. So the minute I heard it, I said, how fortunate, right? What is this? Such an easy thing. Just go and do your MCC, you become an MCC. But then I thought about it, I said, it's not so easy, right? I would rather be a ACC, then PCC, then MCC. Can you imagine the difficulty of being a direct MCC? And that is the achievement Venkat has. But that's not all. Venkat is also the COO at Tata Chemicals, and 30 years of various roles across Unilever, Tata Chemicals, and Rallis India. Venkat is a mechanical engineer and a PGDM from IIM Lucknow, and he's very, very passionate about maximizing the wealth of rural, digital, and agricultural knowledge, workforce, etc., etc. So I'm hoping to learn from as all of you as to what are the opportunities, what is it that we can do as coaches in the medical field from these three stalwarts. Thank you, Venkat. Thank you, Rosari. Thank you, Dr. Pritika. Thank you.
Thanks, Shiva. That was an excellent introduction that you gave to all of us. And I'm personally happy to be part of this conference. And I've got two great speakers. I'm going to use this opportunity to learn very clearly. So rather than share, I'm going to ask questions to both of them. And both of them are experts in their area. So it's going to be a great joy. Just to set the context, I think one of the things that we need to look at it is that why this program in this session? I mean, why is this session in this whole conference? We need to think back about it. Now, we all know that traditionally coaching has been used quite effectively in executive coaching. Many of us have done that as a client, as a coach. However, when we start stepping back, and I think, nothing better than COVID, which actually taught us quite a lot, is that if we take the nursing industry, whether it's the patients or the nursing staff, I'm going to use nursing staff to mean both the doctors and the nurses who are there. We've seen that both parties, the patients as well as the nursing staff, actually go through a lot of stress, a lot of loss of self-confidence, self-doubt. We have seen that patients, when they are in a hospital in a closed door room, they do get depressed. And many a times, many of them feel that their future is bleak and depressing. God knows what will happen to them. And all of us know that many a times, if a patient gets into a depressive state, it's a faster way to reach the creator. So how do you actually get out of it is very important. Similarly, when we look at the nursing staff, they actually go through a lot of stress. They see death, they see sickness, and at the same time, they need to retain the sense of balance so that they can give assurance to patients, so that the patients feel reassured and sorted. Now, how is it that, both these parties, how can coaching help them to sort out their internal crisis and help them to feel empowered, hopeful, and see life in a more positive manner? Can coaching help in moving them to a state of hope? That's going to be the topic that we're going to talk about. And we've got two speakers who are experts in this area, and we will get into talking about it. What I'm going to do is that I'm going to request Dr. Pritika Chari to give an introductory speech for a few minutes on her perspective on this topic. Then I'll request Rosari. Post that, then I will get into a series of questions with both of them, and then leave it open for audience questions. So this is how we'll go through. So with this, I will hand it over to Dr. Pritika. Ma'am, you're on silent. You're on silent, ma'am.
Thank you, Venkat. Good evening to everybody. I'm truly delighted to be part of this conclave. It's a wonderful experience for me because I have always believed that coaching is an important and integral part of healthcare. long before it became fashionable to even talk about it. Because our lives, our goals, our preferences, they're all dynamic. Life is not one just solid straight line. And evolution of these needs is part of the process of growth, support, and guidance. And coaching provides all of this. So when you look at patients, you look at doctors, you look at nurses, you look at trainees undergoing training to become doctors or nurses or other healthcare professionals, you understand that they require one or more types of coaching. And the goals of coaching in healthcare is aimed at enhancing clinical outcomes, quality of life for patients and doctors, because quality of life for the healthcare professional is something which is a neglected area. And any aspect of well-being, a work-life balance or integration. I don't believe in work-life balance. I believe in work-life integration and personal and professional growth. A lot of technical coaching happens. We teach people how to operate, how to do things, how to perform a procedure, etc. But every health professional, I believe, should have coaching skills. And why is this? Because healthcare itself is a very complex environment. Advances in medical knowledge are just unimaginable. Things are changing, new thing discoveries. It's very, very difficult to keep pace. On top of this, we have advances in technology which are influencing the advances in medical knowledge itself. This complex and dynamic and continuously changing environment is the kind of environment in which we work. There is very high responsibility, very high accountability in this profession. There's uncertainty, unpredictability, and ambiguity. So, with all these factors, you can imagine how we also have to be involved in a continuum when it comes to patient care. It's not just the treatment part of it. We have to be involved in prevention, we have to be involved in management of the problem, the rehabilitation, return to community, which is a very, very important component in which healthcare professionals participate, and subsequent maintenance of quality of life. You can understand with all these challenges why healthcare can be something you sometimes regret. Why did I become a doctor? What did I go and land myself in? You feel like that and you want help. You want somebody to be there for you. And that is why I believe that coaching has a great role in healthcare. Another thing about healthcare is it's very isolated, because when we are trained as doctors, particularly, we are taught to be autonomous. So when somebody is dying and I'm saving a life, I'm not looking for A, B, C to be there for me. I have to make a decision on the spot, do what has to be done. And another big challenge which we face in healthcare is we have to get it right every time in the first time. We don't have second chances. Because if we miss that chance, sometimes a patient can die. And this can be very, very stressful. We have to ensure safety, we have to ensure quality of work. This is mandatory. We have ethical dilemmas which we face. There may be poor organizational infrastructure and support, and continuous interaction with patients and facing their negative emotions of fear, anger, embarrassment, anxiety, desperation, the thought of dying. All of this can be very, very difficult because you feel emotionally exhausted at the end of a day where you've handled all this. On top of this, our own personality issues. What kind of personal experiences have I had in my life? What is my emotional maturity level? What is my personal style? Then demographics like age, sex, socioeconomic factors, the number of years I've been working, I've been a doctor now for 50 years. And sometimes I feel, oh my God, should I carry on working? And of course, your family status. So, who is a good health and wellness coach? In my opinion, a healthcare professional can make an excellent health and wellness coach. But they need to be specially trained. They need to be trained in behavior change therapy, which is a separate entity altogether. They have to develop motivational strategies, and that is where a coaching federation like this can teach doctors. They have to learn communication techniques. You know something, only recently communication is being taught to doctors during medical training. A few years ago, we just evolved and developed our bedside manner, if you want to call it, by watching a senior professor or going around, and it's something that just happened. We were not taught how to talk to a dying patient. We were not taught how to explain a bad prognosis to a patient. But now it has become part of the medical curriculum in most countries, and I'm very glad that it is an essential component. And we need to assist the beneficiary of our services to create sustainable change. So it's not enough for the patient to just get over this particular illness. Now with COVID, what we are seeing is long COVID. 3 months later, after the acute illness, they still need our help. So we need to be able to be there for them, to maintain that and to improve their health and well-being over a period of time so that they can get back to their personal and professional lives the way it was earlier. So this puts patients, who are the chief beneficiaries of healthcare services and who are the most important component of any healthcare. So we need to develop patient-centered coaching. We have to teach our patients at least to partially determine their goals. They have to use self-discovery or active learning, or we have to be with them and teach them processes where we teach them content about the disease, we teach them how to handle it, and how to work towards their goals. The most important step, which we find very difficult when we deal with patients, is self-monitoring their behavior to increase accountability. When you have a healthcare awareness meeting, nobody wants to come. Patients don't want to attend these meetings, but because they have to be accountable. When we have a support group meeting, they come because they feel that they get some support. But if it is something where we ask them to be accountable, they try to avoid the meeting. So all of this has to be done within the interpersonal relationship with the coach. And that is why I believe that every healthcare professional should have coaching skills. And we know the softer side of health, the eating better, regular exercise, better sleep, managing stress, fostering social relationships. We all know all this, cultivating gratitude. We know all this. But when we look at healthcare coaching, we sort of raise all this to a much higher level. And I think healthcare coaching is similar to professional sports coaching.
Excellent.
It's not telling the doctor what to do. Many doctors don't like to be coached because they think they know everything. It is someone wants to get better at something. There is someone to watch them, then discuss what they can do and improve their performance. So I think doctors and nurses and healthcare professionals should not buck being coached by professional coaches. Thank you very much.
Excellent, doctor. I think, in a manner, you also stole some of the likely questions that I would have asked along, about how do we actually do that. But brilliant, you brought about a lot of important points about the need for coaching for doctors and nurses, and what is it that can be done to handle some of them. Excellent. I will now, request Rosari to speak about, her piece before I get into the questions.
Thank you very much, Venka, and thank you everyone and ICF India for having me here. I am truly privileged to be with you. I'm trying to just share my screen as I'm talking to you, and I just don't think that's working. So I might ask your organisers there maybe to pull up the slides, and I'll go down through them fairly quickly. Thank you, Dr. Preker, for that wonderful introduction. I concur with so much of what you have said. It totally resonates with me and just so important. On the slides, I don't know if you can see them there, but I'm just speaking through what I have here in any case. But as Dr. Preker has said, healthcare is a unique setting. It is absolutely, you know, doctors, nurses, all staff, they are in a unique position in terms of providing a service to society. So it is more than just a day-to-day job. Our healthcare professionals are intervening in people's lives, sometimes when people are at their most vulnerable. And again, that is a huge challenge and it is a huge privilege. They are presenting, I'm on the previous slide there, Dika, if that's okay. Our healthcare professionals have to present a positive and a realistic image. And that is some challenge, not always easy, but that is what we are asking our healthcare professionals to do on a day-to-day basis. There are no other professions that we are asking that of daily, and it's such a high demand. They are asked to present a positive but a realistic image. Again, that is a huge challenge. They are supporting individuals and families in what they are doing, and likewise, through their clinical leadership, they are actually influencing policy planning, policy development, government policy, enhancing clinical leadership, and crucially, they are involved in co-design and shared leadership. We have moved away from an era where policies, procedures are designed in an office and are just sent out to staff to implement. Neither staff will accept that, nor should they, nor indeed should our public accept them. I'm on the third slide now, Dika, if that's okay. And against that, when we were balancing this whole challenge around the patients, the clients, the service users, some people do not like to be referred to as patients. But when our patients are in the health system, we've all been there. Indeed, doctors, nurses, and healthcare professionals have also been patients. But we can feel overwhelmed. We can feel vulnerable. We can feel anxious. We can feel time poor. We might be adding appointments on to the bottom of our day, to the top of our day, lunchtime appointments. We are trying to incorporate all this complex information that we were receiving from our health professionals, and that cannot be easy. And I think as well, at all times, we're eager to know more. If we get a poor diagnosis, if we're diagnosed with a chronic illness, we want to know more. Where do we need to go to get that? Our health professional may not have the time to spend with us and take us through our own self-management and the other issues and challenges that we have in our lives at the time. And of course, we need trusted advice and support, and we need to know where we are getting that from. So to balance the needs of staff and health professionals against the needs of our patients, that is some challenge, and it is a unique requirement. When we talk about our health services, I like to refer to our health services as human services. They are human services provided by people, for people, with people. And those human services must reflect the society we serve. And in doing that, to be diverse, equal, inclusive. And I really think when we reflect on those services, by people, for people, with people, coaching is valuable, and it is an aligned intervention for both staff and patients, clients, service users. There is no other intervention that I know that meets those needs in a holistic way, in the same way that coaching does. Therefore, as Dr. Preker said in her introduction, it is so valuable for staff, for healthcare professionals, for our organizations, and ultimately for our service users. There is overwhelming evidence that where we get it right for staff, we get it right for patients and service users, even to the point where mortality levels are affected. The academic research on this is by Professor Mike West, and I would encourage you if you have a moment to look at that, but it is overwhelming. In my view, health coaching can really bridge the gap. I have a specific slide on that, DK. If you could bring me to that slide, it's slide 5, and it's called Healthcare Coaching Can Bridge the Gap. And this is actually a real life case study where we had an individual, Mr. Mutha, with diabetes, hypertension, hyperlipidemia. Despite seeing Dr. James 5 or 6 times per year, he is not making progress. He's very frustrated. Dr. James is very frustrated. But when Mr. Muthu is introduced to a health coach. The health coach can spend time on his knowledge skills, building his confidence, how to make him a more active participant, and basically really empower Mr. Muthu in the management of his own life and his own care. We cannot separate one from the other. So really the value of health coaching and that particular case study really is around self-management support, helping Mr. Muthu to navigate a complex system, having continuity, and as I said at the title of the slide, to really bridge the gap. For a moment, I want to talk about new power and old power. And I suppose many of us may have come from an era whereby we were in a situation of old power, top down, held by a few, command and control, closed, transactional. We have moved away from that, and we need to move away from that as a society to a situation of new power, which is current, made by many, managed by many, open. Above all, that is relational based. It is based on relationships, open communication, transparency, and sharing. And again, I think that the coaching intervention can help us so much in moving from that old power to new power. And particularly when we look at generational shifts, we have more Gen Zs coming into the workforce at the moment. They have been reared in an era of new power, and they are going to be so open to coaching. Indeed, some of them, in terms of demographic trends, will be asking what type of coaching is available in the organization when I come in. Dr. Preeka, I would have found with our new non-consultant hospital doctors, they are so progressive, they are so open, they want this support, they want to engage, and they really want to do their jobs to the best of their ability, and they see that coaching can help them do that. I have a slide there, and really it's just a visual on the system, that we cannot expect people to change to fit into our system. We must change to allow people to work with us. And I think that is so important. The slide that's currently in front of you there in terms of the how, we have to move away from, I suppose, telling people. We have to encourage, and people want this, they're crying out for it, to invest in and be partners, active partners in their own health and well-being. Doctors, professionals, they of course will give you the best care and attention that they can. You are living with yourself 24/7, so you must be the active partner, the active participant, and of course a health coach and coaching in general can really help us with that. So in my view and experience, health coaching supports more holistic care, which is what we want. It makes participants and both the deliverers and the receivers of care more confident and assertive. It allows our patients, clients, service users, and our staff to negotiate better. Life is one constant negotiation. It supports better cultural and emotional intelligence, allowing our patients, service users, and clients actively participate as part of the solution to health issues. We don't need to be told. We want to be part of the solution. Moving away from that transactional mindset, command and control, tell, sell, no, all based on positive construction, open relationships, which really we cannot put a price on. So I suppose in my final slide before handing back, Fenka, I particularly like this one. You'll have heard it before. Give a man a fish, you feed him for a day. Teach a man to fish, you feed him for life. With health coaching, I think we are empowering people. We are not imposing solutions. We are giving them skills to deal with illness, whatever it may be, health issues, psychological, emotional, cultural, whatever it may be that are arising for them in their lives, and allowing them to take active ownership and not simply coming in and thinking we can rescue. We cannot rescue people with chronic illness in the way traditionally that we may have thought or approached. We have to allow and empower people to rescue themselves and give them the tools and techniques. And my firm belief is that coaching and health coaching is the best way of doing that. Thank you for the opportunity to speak to you, and I'm really happy to take any questions, comments as you see fit. Thank you.
Thanks, Rosary. I think both of you have given the need for coaching and also some way of how do we actually approach it. Now, I'm going to dive into some of the questions that the audience has asked, and I'm also building on my own questions that I have in my mind. So I'm going to ask Dr. Preetika, She's a doctor. She's been there doing it for more than 50 years. Uh, how do you tell a doctor or a nursing staff that they need to be coached? So I'm going to ask that question to her, and I'm going to ask Rosari the institutional question because she comes from that angle. So I'm going to ask the doctor that how do you tell a doctor, it's good for you to be coached. So become a client, for a change, quote unquote. A doctor is a person who goes and helps people, but to tell a doctor, you also need help. So how do you convince a doctor to go and get coached?
See, one of the things that we tell doctors are resistant on one side because they feel they've studied so much, they know so much. My own qualifications, I'm an MD, DM, PhD, MCH. So, with all these degrees and all that, why should I listen to you if you come and try to coach me? And what is it? Why do I need to have a coach? So, we have seen this resistance. In fact, some people think I'm weird because I have so much emphasis on the coaching element, even with my patient care. Okay, they say you talk too much, you're doing too much for your patient, you don't have to do so much. You're treating the condition, you're making them all right. So I educate my patients. I subspecialize in epilepsy. So there's a lot of education that I do so that they get quality of life, so that they participate. I say, without your cooperation, I cannot make you better. So I empower my patients and go along with them and help them to take responsibility for their own healthcare. Which I think if we have to emphasize this element to the doctor, that they also are under stress and they need. I have done a few stress management workshops for doctors, and let me tell you, people are not very willing to come. Okay, they think they don't need it. And work-life integration, this is another huge area where we as doctors have really tough time. If my mother is sick at home and I am operating on the brain on a patient, I have to wipe my mother out of my brain. I have to focus fully on this. I have to learn the skills on how to do it. And some of us are able to do it, some of us are not able to do it. And that is where, if we have coaching incorporated as part of healthcare training, we will find that people can handle all these difficulties. And you have to, in the end of the day, I want to enjoy my job. I'm here doing this job because I wanted to do it. Another disadvantage which doctors have when it comes to, being taught by anybody else, is we suffer the burden of nobility. Okay, we are supposed to be affable all the time, available all the time, accessible all the time. And this puts a tremendous burden that they feel that if they're too pleasant and too involved in the coaching process of a patient care or something, they will be taken advantage of. So I don't know, as a doctor, I'm telling you, these are the issues that we face. And in India, we have another issue. See, because of poor communication skills, patients sue us. If they sue us all over the world, if they sue us because we have not explained to them what the problem is. 90% of court cases against doctors are due to poor communication. I think Rosari will agree with that.
Absolutely.
In fact, I do communication skills for doctors and medical students. And what sometimes we do is, we have a teenager who's got a brain tumor. We will stand on either side of the bed, the parent and the doctor, talk over his head about the thing. Tomorrow, this is the surgery, this is what we are doing. And we will not even talk to the person who's 19 years old, who's got the tumor, who'll be just getting really worked up. So these are all apparently obvious things, but sometimes we need to teach these things.
I would agree, Dr. Preeka. And I think so. I would go as far as saying that it should be mandatory. I know we have talked about hard skills, soft skills. I suppose I talk really about the human skills. We need these human skills front and foremost in terms of any of our dealings with people, particularly when they're at the most vulnerable. And as you say, not forgetting the crucial role of the health professional in that and the whole impact and the burden that it may have on them. But I do believe, just taking the question on a bit in terms of the organisation, organisations really need to ensure that they are giving staff these tools when they come into the workplace and providing protected time. I know, Dr. Preeki, you said you run your stress management skills and staff don't turn up, and that can be for a multiple of reasons, but it's not necessarily resistant. People can be tired, burnt out, overcommitted, other issues to deal with. So the employer must be moving in with protected time. I am heartened when I see what's happening in the market and in the economy at the moment, because most progressive employers and progressive companies are investing big money here into this area because they see the return, not only in terms of absenteeism, but also in terms of the cost of presenteeism, people at work and not able to engage, and that huge cost. So this is a huge, growing, progressive industry. And I think it is one that will continue to grow, particularly when we see the impact of COVID, the multiplicity of other complexities that we are dealing with in the workforce. So from the employer and from my own background, from that point of view, it's something I think needs to be dialed up. It probably should be mandatory. There should be protected time. And we have plenty of tools to measure the return on investment. But suffice to say, from what we have seen, the return on investment will speak for itself. And in fact, this will be a cost-saving initiative in terms of human cost, which is what we're all about in health service. So I hope that answers, Venka. I think we lost your connection for a moment.
Yeah, for a moment, yeah. Luckily, I had put my question earlier. There was an internet interruption, but thanks for taking it on. So moving on to the next part of it, and I'm looking at also the questions that are coming in from the audience. Clearly, I think what both of you are saying is that one, doctors need coaching. That's one critical point, and there are certain headwinds that we need to take care. And there is a possibility of creating an institutional way of making sure that they are coached. Now, one of the critical things that we need to see is that, and here, Dr. Preetika, I'm going to ask you that, is that is there a way, besides doctors becoming coaches, is there a way that coaching, you could get coaching professionals to come and talk to patients? Is that a possibility that exists?
I think it is a possibility, but then we have trained not pure doctors. We have specialist nurses, we have counselors who are not doctors, but who are there coaching patients, teaching them about the disease and how to manage it. This is very common in chronic illnesses like diabetes, hypertension, after heart surgery, after brain surgery, etc. We have an epilepsy also. We have non-doctors within coaching patients on what to do and how to manage themselves. But it's not a good thing. But patients are very, very non-believing when there is not some strong medical, person talking to them. So I think the coaching process should involve a doctor somewhere, a little bit, or a senior nurse or somebody who's knowledgeable from the patient point of view is, what shall I say, has the authenticity. Because patients sometimes they don't listen to others.
Okay. So what you're saying is that it is better to involve the specialist doctors to be part of that coaching, so that there is greater acceptance by the patients. I think
it should be a team. It should be a team. And I think the coaching process of patients can be as group coaching or as individual coaching, but it has to have a process. And like I said, it's a continuum. And it doesn't just happen during the treatment phase. It happens during the prevention, treatment, rehab, getting them back into society, quality of life, and return to personal and professional efficiency.
Thanks, Doctor. Now, Rosari, you are part of ICF, and being part of it, most of our coaching is executive coaching. I mean, a big chunk of what we do is executive coaching. How do you think executive coaching will be different from medical coaching? What is it? What tweakings do we need to do? Do coaches, for example, and you are a well-established coach, what is it that must a coach do differently if one is coaching an executive in a corporate life or a person who is from the medical field? Is there anything we need to do differently?
Thank you very much, Venka. And just before I answer that, if I could just pick up on the point from Dr. Preeka on the previous question, which I totally agree and support. But I would say very much that health coaching under the clinical governance of the doctor, because I know some GPs in primary care are employing specialist health coaches that will have a clinical qualification, but most importantly are certified. And ICF is very strong on that they are certified, as you say, Dr. Preeka, to make sure that that trust, engagement and buy-in, but certainly under the clinical governance. But not necessarily, I think, in my view, does it need to be a doctor, but under the clinical governance.
Right,
Yeah.
I agree.
Yeah, thanks, Venka. On your specific question then, what we need to do differently, well, if you think about the two different types of coaching, what are the issues that are coming forward for the recipient of coaching? So in terms of health coaching, generally it is, as I understand, it's around stress reduction, weight loss, chronic conditions, smoking cessation, managing multiple comorbidities, etc. Whereas when you're looking at the executive coaching that you're dealing with, you generally have career issues, you have staff who are changing roles, promotion, doubling up on roles, performance at work. So generally, I suppose the issues are different, and how might we approach them differently? I think in health coaching, the recipient of coaching will be more acceptant of more advocacy from the health coach, possibly more directive. Certainly within executive coaching, from my own experience anyway, I would be non-directional, because I always respect the fact that people are the experts in their own lives. The executive coach is not the expert. This is about the individual. It's not about us. So I think approaching it from that specific issue, from that specific lens, it's quite different in terms of, number one, the issues, and number two, the approach. Now, ICF is obviously a very strong advocate of certification, accreditation, and what I would say to anyone out there, if you're starting to implement this in your organization, or indeed if it's something that you're thinking of doing yourself, just to look at the certification requirements to make sure that we continue to build trust and credibility in coaching as a profession. We must do that. And any initiative that we take on cannot be short-term. It can't be because it's the new shiny object in town. We have to always build that credibility of this profession and really show that conversations, credible conversations, can change outcomes, and they can change things for patients, clients, service users and staff.
Wonderful. I'm just going to build on the point that you said about the difference between the kind of issues that medical staff would bring in and corporate clients would bring in. As you rightly said, corporate clients would have things like career, etc. Most of them may not be, most cases will not be life and death issues. Whereas in the case of medical doctors, obviously, the kind of stress that they go to, how does while ICF is very clear on it, how does a coach make sure that it is not counseling and coaching? Because it should not happen that there is a psychological counseling that may be required because a doctor is under a lot of stress. How do you make sure that that difference is still maintained? While of course ICF has those rules, but what would you recommend for a coach?
Well, obviously, I will be very clear on this. Coaching is entirely different, and as you say, it's there set out by ICF. It's not counseling, it's not therapy. You're not encroaching on what a certified health professional will do. With your coaching, we are obviously looking at empowering individuals with coaching conversations, passing on tools and techniques which are appropriate. In terms of coaching in the health service, and particularly looking at some of the high stress professions with clear lines of burnout, etc., and occasionally when we can, in all grades, whatever else, more mental health issues presenting. And we know there is no health without mental health. And certainly I would find that the younger generation is much more open in coming forward and seeking help, which is what we want. But as a credible coach, with your code of ethics, your training, your certification, you do not and you will never dabble in areas that you're not appropriately qualified to do so. So certainly, and that's one of the basics in terms of the training, in terms of all training providers, that you never mix counseling, coaching, therapy, or with therapies or anything like that, that you know your boundaries and you stick with them. And for individuals who are ICF accredited, you will have been through rigorous training. You will have done your performance assessments. You will have done your coach knowledge assessments. The training providers are monitored by ICF. And I'm comfortable that we have a high standard in terms of coaches knowing what they can and what they can't do.
Thanks, Rosari.
Can I answer?
Yeah, please, doctor. Yeah.
Okay. I think when it comes to healthcare coaching, one of the important ways in which you can approach the client is by motivational interviewing, because that it's a different way of than what you would with executive coaching. And in healthcare coaching, active listening is a very, very important tool we have to focus on, both as a medical professional as well as a patient. We have to encourage and empower them to be able to listen actively, because then only they're going to get empowered. And there is something called the trans-theoretical model of change, which goes through 6 steps. And I think that is very, very relevant in healthcare coaching and not necessarily relevant in executive coaching. I'm not, in the interest of time, I'm not going through the steps. But what it does is, the pre-contemplation stage is, I'm not going to do anything. We have patients who just tell us, no, I will not do this. And they get into contemplation, then they take action, then they maintain it, and then there's a relapse also. So this is a very important thing which doesn't apply in the executive coaching arena. And methods of prevention. In healthcare, a lot of prevention activity has to be given as empowerment to the client, both as doctors and as patients.
So, doctor,
because I think coaching is actually what we observe, we debrief, and then the individual gets an aha moment for themselves. I think that's what we do when we coach. And so we sit somewhere between advocacy, where we tell the patient, and inquiry, where we ask them. So we sort
Doctor, I'm going to ask you one question, and this, it may be a little ticklish one. Building on what you said, that the doctors have to listen, and then because in coaching, one of the critical things is listening and being present. Now we all know that doctors are very, very rushed people. Time is at a premium for them. When they come into a hospital, they've got probably 20 patients to look at, and they've got 1 hour. They have to keep looking at every patient for 5 minutes, 2 to 3 minutes. Whereas, if you have to be a good coach, you have to be a good listener, you have to give time to the patients. How do you incorporate that capability to a doctor who has got shortage of time, but yet has to play a role of a good coach to a patient in that maybe 3 minutes, 5 minutes that the doctor has with that patient?
This is a very, very special challenge which all doctors all over the world face. And all patients are always dissatisfied that the doctor has not given them enough time. Even if you spend 1 hour with them, they'll come out saying that that was not enough time. So what you need to do as a as a doctor, is you have to develop a certain methodology where you will spend so much time on the history taking and so much time on the examination. You have to slot your patient appointments giving that time gap. And like, I'll give you an example. Like, supposing I've seen 20 patients in the day, and a new patient comes at 5 o'clock as I'm leaving and says, please give me an appointment today. The way I tell them is, I tell them, look here, I am tired. If I see you now, I can see you, I can pocket the fees, and if I see you now, I will not be giving you my best. So would you like to make an appointment for tomorrow or day after or whatever? 90% of patients will say, fine, I'll take the appointment later. So we also have to understand how to tell the patient that we don't have the time at that time to see. So
Okay.
all this can be taught through coaching actually, because it's communication skills, which is not formally taught to most of us as doctors. We bungle along and then somewhere along the way we strike our own balance.
I think that's a good point that you mentioned about it. And if I just take it to the next step in terms of, you also spoke about that taking care of patients is not exactly what happens within a hospital or there, but even the pre and the post are pretty part of it. Where do you think doctors as coaches can play a role outside the hospital boundary?
I think we could refer a patient when it is in the rehab and getting back to society stage, when their outcome, the quality of life, improving quality of life. See, I run a coaching initiative called Be Your Best with Dr. Pritika Chari. Okay, and the focus is improved outcome after an illness or a life challenge. Whatever your outcome is, we can improve it that much further. That is where coaching plays a role, because you enhance the quality of life, and if you're not sick, you can enhance your level of wellness, health and wellness. So that is the kind of, and I, being a neurologist, I do brain health coaching. So I tell them your mindset, your fixed mindset versus your growth mindset, how your thoughts can kill you or make you okay. So, and I myself am a cancer survivor. So I tell them I've been there, done it. So you can have a very positive way in which you can make things. And this positive psychology is abused. That term is abused a lot and overused, and it has to be. It's no use just telling you you'll be all right. You have cancer. You have grade 3 cancer. You'll be gone in one year. How am I supposed to handle it?
Absolutely,
That's where
absolutely,
the
Doctor.
coaches can play a role.
Absolutely. So coming to you, Rosari, the question is that, again, building on what Dr. Pritika said, that wellness is about not only in the hospital, but outside it. Now, how much does a corporate play focus upon, corporates normally tend to focus quite a lot on getting the best work out of the employees, and they tend to they give executive coaching to people who are not performing well, etc., etc. That's where the focus is, how to make the person more productive. How can we get the whole concept of being healthy into a corporate? How do we bring in health coaching into a corporate world?
Well, I think that a lot of corporates have picked up this particular initiative and they're running with it. Probably more advanced in some areas than certainly the public health service, although we are improving. But I know this whole industry is expected to reach a value of 15.5 billion by 2024. So it is growing. The progressive corporates, they have their health and wellness programs for staff because they realize that they won't have retention issues. And certain demographics really want to see this when they join an organization. They want to know more, that particularly the newer generations, it's not all about salary, income, it's about their whole life, their health, their wellness, that work-life merge. How can they get the best from it? And progressive corporates know this, they're ahead of the curve on it, and they are investing. Programs like employee wellness programs, employee assistant programs, your health is your wealth, and all of these are running, they are being invested in. And we all know, I mean, the evidence is there, it's indisputable that where you have healthy, high motivated staff, they're going to be happier at work, they're going to perform better, outcomes will be better for them and for those they serve. So really it's around corporates understanding that all of this is a fusion of skills. It's not a one size fits all, but certainly having your coaching underpinning your health and wellness initiatives, I think will give you a better return. The evidence is there actually, that it will give you a better return. And the corporates are running ahead with this, and it is just a growing market and it's going to continue to grow.
Great. I think wonderful. Yeah, Doctor. Yeah, you were wanting to say something.
In India, we have many of our corporates have got initiatives for emergency medical care on the spot. But health and wellness initiatives, I think, is still underdeveloped in many corporates in India. That's my impression. I'm not sure if I'm right, but I think it could be more, there could be more presence of this. In fact, there was an IT company where I once asked them, if one of your employees is feeling, stressed out, is there a room you have where they can just go and sit down, a quiet place where they can relax, listen to some music or something like that? And they said, yeah, they can go and sit in the canteen. You see, that's all. The concept is as trivial as that the person needs a quiet place to just sit down and maybe unwind, is something that doesn't enter their vocabulary. So we need to actually increase this. And I think companies are taking it up, like she said, the bigger ones are doing it. But sometimes I feel they just don't care. Sorry to be so blunt, but no, because I see so many IT professionals who are so stressed out. Nothing is actually physically, medically wrong with them. It's just the whole pressure of everything, and they feel out of control. And sometimes I don't know what to tell them, because they need the infrastructure. They need the environment in which they can do some of the things I tell them to do.
Oh, actually, on that, doctor, let me, in my company, we have tied up with, this something last year, we tied up with, medical professionals, especially for stress management and other areas. So, outside the body, anything to do with mind, is something that we have recently started. Yeah, you're right. But most organizations don't focus so much on the health. They focus on the health, but not so much on the mental part of it. So that's a. So clearly, I think
if you don't take offense,
yeah,
you said we recently started.
Absolutely, doctor. Absolutely. It's something which corporates are now realizing the importance of mental health as much as physical health. I think that's an important thing.
No, but it took a pandemic to tell us how much mental health is important.
No, absolutely, doctor. So, I just got mention from Shiva that we need to start wrapping off. So what I need to do is that if, I would request both of you to kind of give a minute of a summary of what would you say as what should be the listeners in this program take out, and then I will then wrap it up with my summary of the session. So, doctor, you want to go first? In a minute,
Rosari can go. If she's covered what I want to say, she can.
Not at all, not at all. You're on a roll there. Keep it up.
Okay. I personally feel that patients should take more responsibility for their own care, and they should be partners together with the doctor in order to make themselves better and to maintain their lifestyle. They should have accountability, which will help them get better and which will help me to help them to get better. The second thing is, doctors and nurses are a neglected lot as far as their stress levels in their lives and their work-life integration is concerned. And they can benefit with organizational and other initiatives where they are given time off to be coached and to be supported and to be helped to handle sometimes what they are very good. We are sometimes very good at telling others what to do. But when it comes to our own personal lives, we make a mess of it. And so we need help. That somebody has to take us. After my cancer, I engaged a coach for 6 months because I couldn't decide whether I should give up practice, whether I should, or retire, what I should do. And I got clarity. So sometimes all the medical professional needs is someone to help us to get clarity. We know our professional goals, but sometimes clarity in our life goals is confusing.
Wonderful, wonderful, doctor. That's a great piece of input and advice for all of us. Rosari?
Thanks very much. And I suppose just to pick up, I totally support everything that has been said. And when we find ourselves in difficulty, either in our own lives from a health point of view, or indeed in the workplace, it can be a very lonely place. People can be very isolated. They might not have a trusted advisor to take them through those challenging issues. From what I have seen, coaching and health coaching is the answer. So in terms of any of the vulnerabilities that are there, a safe, confidential, supportive, empowering process that will motivate individuals to be experts in their own healthcare, in their own lives, and in terms of their role they are playing in organizations, that this has to be the way of the future. I would specifically reference the ICF core competencies around presence, active listening, all the competencies that are there that are evident we need to see in this specific, when we look at the health coaching with this particular lens. So I think the work is done. We know what needs to be done, but we must move away from a rhetoric reality gap and move now in a coherent way towards implementation to make lives better for us all ultimately.
Thanks, Rosari. I think that's brilliant. So I'm just going to kind of, if I summarize from both what you have said is very clearly is that there is definitely a tearing need for coaching, for patients. There is a tearing need for the nursing staff, which is the doctors and nurses. And what I also hear is that many hospitals, many professionals are actually recognizing this need and working towards it. Many hospitals have already started off. So it's a wonderful thing that this is happening. And I'm sure that it's going to be music to all the coaches, because most of our audience are all coaches or likely to be coaches. So it's going to be music to everybody, saying that the field is now opening up. So in a sense that, coaches have primarily concentrated on executive coaching, and the whole concept of health coaching is a new area which is opening up, and there could be huge opportunities for that, whether it is for patients, whether it is for doctors and nurses. It's a great field going ahead. And both of you have given tips on how do they actually have to approach it. Wonderful. Thank you very much for this great session. I have learned a lot talking to both of you, and it's been a pleasure. And with this, I will hand it back to Shiva, our host for the day. Shiva.
Yeah, so thank you. I have been doing two things in the last 1 hour. I have been listening to you, and I have been WhatsApping all my conclave friends, saying that every time I hear Rosari and Dr. Pritika, I'm listening to completely new opportunities opening up. And I am visualizing a partnership between between an organization like ICF and the medical profession, where we and you as doctors and we as coaches, and the amount of energy, the amount of a symbiotic relationship can happen, where where we not only come to coach, but we also help, we also learn from you, right? I don't want to be coaching a patient without knowing the medical side of that patient. So I'm looking at a partnership where one day I can actually partner with Dr. Pritika Chari or with Rosani, and there's a coachee in front of us who's just gone through some horrible issues, and I am trying to help. And Rosari and Dr. Pritika is telling me, Shiva, let's do this. So I'm visualizing an entirely new partnership, right? And for bringing that partnership into life, for sowing the seeds of what could be one of the most important aspects of coaching in the next 3, 4, 5 years, where doctors and coaches will together make life easier for everybody, all the stakeholders. So thank you so much. I'm actually gushing about all the things I've learned, right? And so I also want to thank, and I know how difficult it is for you to get away for 1 hour and talk, and the other things that happen, like we prepared and everything. So I'm grateful for all of that. Thanks, Venkat, for a very nice, inclusive moderation, right? You included the questions, the audience, everything, right? Thank you very much. I also have to thank the sponsors, because without them, nothing happens. And therefore, thank you very much for the sponsors. Thank you to the audience. because without the audience, nothing happens. And therefore, thank you very much.